Hi friends, I'm Dr. Pratap Sinato. I have done MD in Physics Medicine. In today's video, we will continue with metallic poisons and that we will discuss about mercury. As we all know, mercury occurs as a liquid metal which is available in thermometers. It's a bright silvery appearance and is volatile at room temperature. It forms two series of compounds. It is mercuric, which are soluble and intensely poisonous. Mercurous, which are much less soluble and therefore less active. Metallic form of mercury is not poisonous and it is not absorbed, but it is get absorbed if it is breathed or swallowed as vapor or it is applied to skin or mucous membrane. Different poisonous compounds of mercury includes mercury chloride, which is colorless mass of prismatic crystals or as a white crystalline powder. It has a skeptic, nauseous, and metallic taste. Then there's mercury oxide, which is a brick red crystalline powder. Mercury iodide, which is scarlet red powder. Mercury cyanide, which is white prismatic crystals. Mercury sulfide, also known as cinnabar, sindoor, since it was used in the older days as a form of sindoor in Indian Hindu women's, or red crystalline powder, also known as vermilion. Then there is mercurous chloride, which is calomel. Then mercuric nitrite, mercury sulfate, white crystalline powder, sulfate of mercury, lamellar powder, ammonia mercury chloride, different organic compounds of mercury, and mercury thiocyanate, which is used in Diwalis as a form of dye. Coming to mechanism of action, mercury cyanide binds with sulfuride groups of enzymes and cellular proteins, nucleic acids, and mitotic apparatus, interfering with enzymes and cellular transport functions, leading to cell death. In the CNS, it acts mainly upon the cerebellum, temporal lobe, basic ganglia, and corpus callosum. Coming to symptoms, it appears in 22 forms. It is first phase and second phase. In first phase, there is a person who consumes has a metallic taste, acrid metallic taste, feeling of constriction in throat, hoarse voice, difficulty in breathing, burning pain, and GI tract is swollen and corroded. The vomit contains mainly a grayish, slimy mucoid material, diarrhea, blood-stained stools at isthmus, which may be continued, which if it is followed lead to dehydration. Then there is inhalation of fumes may lead to nervous symptoms like ataxia, restriction of visual fields, paralysis, and delirium. Second phase occurs mainly if the person survives first phase and begins 1 to 3 days. There is glossatitis, ulcerative gingivitis, severe infection, loosening of teeth, necrosis of jaw. Then in 2 to 3 days, there is renal tuberous mesh necrosis, reduced transient polyuria, albuminuria, cylindruria, uremia, and acidosis. Recovery mainly occurs within 10 to 14 days. Organic mercurialis are organic form of mercury like phenyl methyl methyl mercury, ethyl methyl mercury are more toxic. They have serious symptoms like ataxia, dysarthria, paresthesia, neuropathies, mental deterioration, and chorea. Beta dose of is 1 to 2 gram that is mercury of mercury chloride commonly poisonous. The infected period is 3 to 5 days. Treatment first gastric lavage is done using any form like milk, egg white has a demulcents or salt pour albumin or 2 to 5% of salt sodium bicarbonate is used. They bind with mercury and eliminate becomes easily eliminated. Then chelation by penicillamine, which is less severe for mainly used for less severe mercury weapons and inorganic mercury poisoning. BL is the chelating agent of choice. BL and penicillamine should not be used since they form toxic compounds. Calcium material also should not be used since it is nephrotoxic and mercury causes renal tuber necrosis. Urine must be kept alkaline for easy excretions. Then colonic lavage can be done to remove any mercury present in the colon. Then hemodialysis again it is done if there is a significant kidney damages present. Coming to postmortem appearance, there is no specific changes seen in the mercury poisonings, but mainly generalized symptoms, generalized changes are seen like in GI tract there is shows inflammation, congestion, coagulation, corrosion. There may be acute tubular glomerular degeneration or hemorrhagic glomerular nephritis is seen. Liver is congested and show cloudy swelling or fatty change. Coming to chronic poisoning of mercury, it is also known as hydagrism. It may result mainly in cases of the person who are continuously exposed to mercury, like in accidental absorption by the workers, excessive therapeutic usage, from recovery from large doses of mercury, and in case if the ointment is used as an external application for a long time. Symptoms includes classic triad may of in mouth includes gingivitis, stomatitis, followed by tremors and neurosecretory changes. So there is mouth symptoms, then tremors, then neurosecretory changes are the triad of symptoms seen in the chronic poisoning. In mouth, there is gingivitis, stomatitis, and salivation. Typically, there is salivation, inflammation of gums. Occasionally, blue line is seen at the junction with teeth, sore mouth and throat, loosening of the teeth, gastrointestinal disturbances, anemia, anorexia, loss of weight, all are present. Then chronic inflammation of kidneys and progressive anemia occurs. Then it is followed by tremors, which is also called as Danbury tremors, which occurs first in the hands. Hand tremors are present, which later followed by limbs and tongues, and finally involves the arms and legs. The advanced condition is also called as Hatter's shakes, glass blower shakes, since it is commonly seen in person working with glass blowing and hat industries. The most severe form of is known as concussio medicularis, in which there is no activity is possible. The person is not able to lift anything because of continuous tremors is present. Next, mercury atherism. This is also one form of chronic mercury poisoning. It is seen in person working in mercury in mineral manufacturing firms. Symptoms include anxiety, depression, sinus, timidity, irritability, loss of confidence, mental depression, delusions, hallucinations, suicidal melancholia, manic depressive psychosis, which is also called as Manhattan disease, since it was seen in person who used to wear hat for longer duration. And in older days, the hat lining used to be consist of mercury, since in that because of that, the person who is chronically wears the hat had depressive psychosis. Then, since the name Manhattan disease, then emotional instability, loss of memory, and insomnia is also seen. Next form of chronic mercury poisoning is to mercuric lentis. It is seen in the eye. Macular eye changes are seen due to exposure to vapors of mercury. It is due to chronic deposit of mercury through the cornea on the anterior lens capsule. In that, there may be renal damage may also results in membranous glomerulonephritis with saline cast and fatty cast in the urine. Coming to acrodynia or pink, this is also one form of chronic mercury poisoning. It is characterized by generalized body rash and is thought to be a idiosyncratic hypersensitive reaction, but it is mainly because of chronic mercury exposure in any form. Hands and feet shows puffy, pinkish, painful, parasitic, and peeling of skin is seen. Teeth may also be shed in this disease. Minimata disease is also one form of disease caused in mercury because of mercury. It was seen in Japan in 1956 due to consumption of fish which was poisoned by mercury in Minamata Bay, hence the name of Minamata disease. Treatment of chronic mercury poisoning involves removing the patient from the further exposure, demulcents, milk like white, saline purgatives, oral hygiene, chelation therapy mainly by deep and or DMPS. For organic mercury chelation is not very effective and symptom treatment is given. Going to fate and excretion of mercury. Once the mercury is absorbed, the mercury ion is distributed between blood cells and plasma. It is then diffused into tissues where it is rapidly binds to most of protein supported groups. Mercury is important in all tissues, particularly liver, kidneys, spleen, and bones. It is excreted by kidneys, liver, and colonic mucous membrane. It is also excreted in saliva, milk, sweat, and feces if quantity is large. It passes rapidly in the fetus in utero through placental circulation. It is a not constituent of a human body, but normally there is some less than 10 microgram of a liter of mercury is present in the body. Test to detect mercury. So any solution if present, if a piece of copper wire is introduced in that solution and a few drops of hydrochloric acid is added, then there is a coating of mercury will be formed if mercury is present. Coming to circumstance of poisoning, accidental poisoning is commonest by mercury chloride due to a strong solution in washing abscess cavities or irrigating in vagina, uterus, or rectum. Sometimes it is into the vagina as a contraceptive or for producing abortion. Homicide and suicide poisoning is rare. These are my references. Thank you.